Welcome to learningayurveda.com. Today we are learning the first chapter of Sutrasthana of Ashtanga Hrudaya. Ashtanga Hrudaya is a famous Ayurvedic textbook. It is written by an ancient seer called as Vagbhata. The chapter name is Ayush Kamiya Adhyaya. First, salutations to the unique and rare physician who has destroyed without any residue all the diseases like raga, that is, lust, anger, greed, arrogance, jealousy, selfishness, ego, which are constantly associated with the body, which is spread all over the body, giving rise to disease, delusion, and restlessness. Next, purpose of life. It says that Ayuh Kamaya Manena Dharmartha Sukha Sadhanam Ayurvedopadesheshu Vidheyaha Paramadaraha. It means that to achieve the purpose of life, that is dharma, following the path of righteousness, artha, earning money in a legal way, kama, fulfilling our desire, moksha, achieving salvation. So to achieve these four purposes of life, one should concentrate on having a long life. To learn the science of Ayurveda, which explains how to achieve this goal, obedience or vidheyate is the most important quality. Next, origin of Ayurveda. Lord Brahma, remembering the rich knowledge of Ayurveda, taught it to Prajapati. He in turn taught it to Ashwini Kumaras. They taught it to Sahasraksha, that is Lord Indra. He further taught it to Atri's son called as Atreya Punarvasu and other sages. And they in turn taught it to Agnivesha, and thus Agnivesha onwards composed treatises on Ayurveda and led to dawn of Ayurveda on this planet Earth. Next, importance of Ashtanga Hrudaya. From those Ayurvedic textbooks which are too elaborate and hence very difficult to study, only the essence is collected and presented in the form of Ashtanga Hrudaya, which is neither too short or not too elaborate. Branches of Ayurveda. It says, Kaya Bala Grahor Duvanga Shalya Damstra Jara Vrashan Ashtavangani Tasyahu Chikitsa Yeshu Samshrita. Kaya Chikitsa, General Medicine, Bala Chikitsa, Pediatrics, Graha Chikitsa, Psychiatry, Urdhvanga Chikitsa, this is disease and treatment of ear, nose, throat, eyes and head, Shalya Chikitsa, surgery, Damsha Chikitsa, toxicology, Jara Chikitsa, geriatrics, Rasha Chikitsa, aphrodisiac therapy. These are the 8 branches of Ayurveda. Next, Tridosha. Vayu Pittam Kafascheti Trayo Doshaha Samasataha Vikrita Avikrita Deham Gnantite Vartayanticha. Vata, Pitta and Kapha are the 3 doshas of the body. Perfect balance of these 3 doshas leads to health, and imbalance in Tridosha leads to disease. How Tridosha are spread in body and in a day. Te vyapino api hrannabhyo adho mardhyo urdhva samshrayaha vayoho ratri bhuktanam te anta madhyadigah kramat. That means the Tridosha are present all over the body, but the presence is especially seen in particular parts. If you divide the body into 3 parts, the top part up to chest is dominated by Kapha dosha. That's why in the lungs and all the respiratory diseases are usually of Kapha in origin. Between chest to umbilicus, the stomach part is dominated by Pitta. That's why digestive disorders are usually of Pitta in origin. Below umbilicus part is dominated by Vata. That's why the joint pains, the arthritis, etc. affecting the knees and the lower back are of Vata in origin. Similarly, in a person's life, the first part of life is dominated by Kapha, second part by Pitta and the last part by Vata. And in also day and night, the first part is dominated by Kapha, second part is dominated by Pitta and third part is dominated by Vata. While eating and during digestion also the same rule applies. Next, types of digestive fires. Thairbhavet Vishamaha Tikshno Mandaschagnihi Samahi Samaha means there are four types of digestive fire. Vishama Agni, influenced by Vata. A person with Vishama Agni will sometimes have high appetite and sometimes low appetite. Tikshna Agni, influenced by Pitta. A person with Tikshna Agni will have high digestion power and appetite. Manda Agni, influenced by Kapha. A person with Manda Agni will have low digestion power and low appetite. Sama Agni, influenced by perfect balance of Tridosha, where person will have proper appetite and digestion power. Next, types of digestive tracts or nature of bowels. It's called as Koshta. Koshtaha Kruro Mrudur Madhyo Madhya Sattaihi Samairapi. There are three types of digestive tracts. Krura Kosta, wherein the person will take long time for digestion, the bowel evacuation will be irregular. It is influenced by Vata. Next is Mrudu Kosta, sensitive stomach and has a very short digestion period. Even administration of milk will cause bowel evacuation. Madhya Kosta, proper digestive tract, bowel evacuation at proper times. It is influenced by Tridosha balance. Next, types of body types. शुक्रार्थवस्थैः जन्मादौ विषेणैव विषकृमेः तैश्च तिस्र प्रकृतयो हीनमध्योत्तमाः पृथक् समधातुः समस्तासु श्रेष्ठा निन्द्या द्विदोष च. It says, like the poison is natural and inherent to poisonous insects, similarly the Prakruti or body type is inherent to human beings. The body type is decided during conception based on qualities of sperm and womb. Vata body type is considered as low quality, Pitta body type is considered as moderate quality, and Kapha body type is considered as good quality. Tridosha body type, wherein it is influenced by equally by Vata, Pitta and Kapha, is considered as best quality. Next, dual body types like Vata Pitta or Pitta Kapha or Vata Kapha body types are considered as not good. Next, quality of Vata. Tatra ruksho laguhu shitaha khara sukshmaschalo anilaha means ruksha dryness, laghu lightness, coldness, roughness, minuteness and movement are the qualities of Vata. Next, qualities of Pitta. Pittam sasneha tikshnoshnam laghu visram saram dhravam. Oiliness, unctuousness, piercing quality, entering into deep tissues, hotness, lightness, bad smell, having fluidity, movement and liquidity are the qualities of Pitta. Next, qualities of Kapha. Snigdha shito gurur mandaha shlakshno mrasna sthiraha kafaha. That means oily, unctuousness, cold, heavy, mild, viscous, smooth, clear, slimy, jelly, stability, immobility are the qualities of Kapha. The increase, decrease of individual doshas or imbalance of couple of these doshas is called as samsarga, and imbalance of all the three doshas together is called as sannipata. Next, body tissues and waste products. Body tissues and waste products are called as dushyas, means these are influenced and affected by doshas. Body tissues are rasa. This is the first product of digestion. Soon after digestion of food, the digested food turns into rasa. It is grossly compared to lymph or plasma, but it is not a complete comparison. Next, rakta, also called as asruk or blood. Mamsa is muscle, meda, that is fatty tissue, asti, bones and cartilages, majja, bone marrow, shukra, semen of ovum or entire male or female genital tract and its secretions are grossly covered under this heading of shukra. Mala, that is waste products, are feces, sweat and urine. Nature of increase and decrease. Vriddhi samanaihi sarvesham viparitaihi viparyayaha. Equal qualities lead to increase and opposing qualities lead to decrease. For example, dryness is the quality of Vata. If a Vata body type person exposes himself to dry, cold weather, his dryness and in turn Vata will increase, leading to dry skin. In the same way, oiliness is opposite quality of dryness. If he applies oil to the skin, then the dryness and related vata is decreased. Next, 6 tastes according to Ayurveda. Swadhu or Madhura is sweet, Amla sour, Lavana salt, Tikta bitter, Ushna or Katu pungent, Kashaya astringent. These are the 6 types of tastes according to Ayurveda. They are successively lower in energy. That means sweet taste imparts maximum energy to the body and the astringent imparts least energy to the body. Effect of tastes on Tridosha. Tatradya marutam gnanti, trayah tiktadayah kafam, kashaya tikta madhuraha, pitta manyetu kurvate. In the list of tastes, the first 3, that is sweet, sour and salt, mitigates vata and increases kapha. The last 3, that is bitter, pungent and astringent taste, mitigates kapha and increases vata. The astringent, bitter and sweet tastes mitigate pitta, and sour, salt and pungent tastes increase pitta. Types of food substances. There are 3 types of food substances. One is Shamana, food that brings down the increased dosha to normalcy. Kopana, food that increases the lowered dosha to normalcy. And Swasthahita, food that maintains the normalcy of 3 doshas and health. Types of potency or Veerya. Ushna Veerya, hot potency. Some food items are naturally hot in nature, for example pepper. Shita Veerya, cold potency. Some food items are cold in nature, for example milk. These are the 2 types of potencies. Generally, the substances that have astringent, bitter and sweet tastes are coolant in nature, and sour, salt and pungent tastes are hot in nature. 3 types of Vipaka. Vipaka refers to conversion of taste after initial phase of digestion. Madhura Vipaka or sweet conversion of taste. Generally, sweet and salt tastes undergo this type of conversion. Amla Vipaka or sour taste undergoes this Vipaka. Next, Katu Vipaka, rest of the tastes, bitter, astringent and pungent tastes undergo this Vipaka. Next, 20 types of qualities. Heavy and light, slow and quick, cold and hot, unctuous and dry, smooth and rough, solid and liquid, soft and hard, stable and unstable or moving, small or big, non-slimy and slimy. These are the 20 qualities explained as per Ayurveda. Next, cause for health and disease. Less, more or wrong unison of time, senses and functions is the reason for disease, and the right unison of these 3 factors is the reason for health. Next, definition of health and disease. Rogastu dosha vaishamyam, dosha samyam arogata. Imbalance of Tridosha is a disease, and perfect balance of Tridosha is health. Types of disease. Nija Roga, disease caused due to imbalance in internal factors, for example, eating excessive hot substances leading to gastritis. Next, Agantu Roga, disease caused due to external factors such as injuries. Both these types of disease can occur to body and mind. Types of mental doshas. Rajas, quality of mind that drives us to take action, and tamas, that leads to inaction and lethargy. These are the types of mental doshas. How to test a patient? Darshana, by means of inspection and observation. Sparshana, by means of touching, and prashna, by means of asking. Next, examination of disease. Disease should be examined by its nidana, cause and etiology, pragrupa or purvarupa, prodromal symptoms and premonitory symptoms, lakshana, specific signs and symptoms, clinical features, upashaya, diagnostic tests, apti or samprapti or pathogenesis. Next, types of habitat. Habitat or desha in this science is said to be of two kinds. One is Bhumi Desha, that is land, and Deha Desha, that is body. This land is of three types. First one is Jangala, which is predominated by Vata, which is arid or a desert like land with no mountains or hills, has less vegetation, poor water resources, and is more breezy. Next, Anupadesha, which is predominated by Kapha, marshy land with more of water, more vegetation, very less sunlight and heat. Next, Sadharana Desha, which has all the Tridoshas in balance, moderate type with few mountains, hills, moderate water, vegetation and sunlight. Kinds of time. There are two kinds of time that are considered. One is normal time, as in seconds, hours, etc. And another one is stages of diseases. Next, types of medicine. There are two types of medicine. One is Shamana, palliative treatment, which brings the doshas to normalcy, useful in initial stages of diseases. Next is Shodhana, purification treatment, which expels imbalanced dosha out of body, useful in aggravated stages of diseases. Example for Vata, enema is the Shodhana treatment and oil is the Shamana treatment. For Pitta, Virechana, purgation is the Shodhana and ghee is Shamana treatment. For Kapha, Vamana or emesis is the Shodhana treatment and honey is Shamana treatment. Next, treatment of mental imbalance. Dhi, improving intelligence. Dhairya, improving courage. And Atma Vijnana, self-realization. These are the means to treat mental imbalance and mental diseases. Next, 16 factors of treatment, also called as Chikitsa Chatushpada. Bhishak, that is doctor, medicine, nurse and patient. These are the four factors of treatment. Each of these four have further four qualities each. Next, qualities of doctor. He should be alert and disciplined. He should have detailed knowledge about disease and treatment. He should be having practical experience and cleanliness. Next, qualities of medicine. Ability to formulate in different dosage forms like decoction, powder, herbal oil, etc. Having enormous qualities, endowed with virtues, suitable and appropriate for specific diseases. These are the qualities of medicine. Next, qualities of nurse. Compassion towards patient, cleanliness, alert and being active, and intelligence. These are the four qualities of nurse. Next, qualities of patient. Rich. According to Ayurveda, the patient should be rich. Next, Bhishagvashya, that is 100% obedience towards doctor, good memory, and having good strength to tolerate disease and treatment. These are the qualities to look for in patient. Types of diseases. There are two main types which are further divided into further two types. One is Sadhya, which can be cured. It is of two types, easy to cure and difficult to cure. Next, Asadhya, which cannot be cured. It is of further two types, Yapya, which require medicine for as long as patient is alive, and Anupakrama, wherein nothing can be done. Qualities of diseases which can be cured easily. Sarvaushadha Kshamam Dehe. The body of patient is able to tolerate all types of medicine. If the patient is young, if the patient is having good control over sense organs who follow abstinence, if the disease is not affected sensitive areas like brain, heart, kidney, etc., if the cause of disease is mild, if the symptoms are mild, and if there are no complications, if the dosha involved, the body tissue involved, the place, season, body types, these are all not influenced by one particular dosha, then that is easy to cure. Next, if all the 16 qualities of doctor, patient, etc., which are explained before, are present together, next, if the astrology is in favor of the patient, if the disease is due to only one dosha, if only one body channel is affected, and if the disease is of recent origin, then such a disease is very easy to treat. Qualities of difficult to treat diseases. Diseases which require the use of sharp instruments, which require surgery in treatment, and also those which have mixture of factors enumerated in previous verses are difficult to treat. Diseases which have features entirely opposite of curable diseases, which have stayed for long period of time, involving all the important tissues and vital organs, which have produced anxiety, fear of death, delusion, and restlessness, which are presenting fatal signs and which cause loss of sense organs, are impossible to cure. Such types of diseases require no therapy and they are worth rejecting. Next, patient worth rejection. The physician should reject the patient who is hated by physicians and the king and who hates them, who hates himself and who is not having equipments and other facilities required for treatment, who is busy with other activities, not having the required attention, leisure, etc. towards the treatment, who is disobedient to the physician, whose life is coming to an end, and who is evil-minded, and who is afflicted with great grief, who is full of fear, who is ungrateful, and who thinks himself to be physician in respect of deciding drugs, therapies, food, activities, etc. Such a patient is worth rejecting. So this completes the contents of first chapter of Sutrasthana of Ashtanga Hrudaya, which explains all the basic principles of Ayurveda. To learn more about Ayurveda, please visit learningayurveda.com.